Hello, welcome to our new video. Today we will discuss the stem cell therapy and its advantages during hair transplantation procedures. Dear Professor, welcome. How are you?
Hi, and how are you?
Thank you very much. Nice to see you here.
It's nice to see you, and I'm very happy to be with this team actually, and I hope that our listeners and our viewers and our followers will pay attention to this crucial and important video that we're going to explain about, because we know that there are a lot of clinics around the world. They say that they're assuming that they're doing stem cell therapy, but to be honest, we want to inform our clients and our followers that what is the true fact behind it. And everybody, I think, is mixing it with PRP, right?
Yes.
There's a lot of clinics that are doing PRP and they think that they're doing the stem cells. So this misnomer and this mistake should be corrected. So first of all, if you don't mind, I want to explain a little bit about that.
Yeah, please.
So first of all, we have to know what PRP is. Actually, it is a type of cells that, it's not cells actually, they're bodies of cells are existing in our blood. And normally they're isolated by taking a sample of blood from the patient, and then it is centrifugate and separated, and then it's re-injected into the scalp area. So that's called PRP. Of course, those cell bodies have growth factors that promotes a good environment for healing when you're doing the hair transplantation procedure, but it is not stem cells. So it's totally different aspect. It's a totally different science, and we should discriminate between both applications, right?
Absolutely.
I guess so. And I think you're a well-experienced hair transplant specialist, and I know that in the clinics that you've worked in previously, that basically PRP was the standard, right? Yes. But I think none of the clinics were doing what we're doing now.
None of the clinic in the world, I think.
Perhaps that would be very, 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 very serious judgment, but I think so, not being sure 100%, but we might be the only one doing it. Now, if we want me to explain what we are doing, actually what we're doing, we're harvesting the cells. We're harvesting it from, thank for Dr. Tarek, because if the patient were not knocked down, we would never ever be able to do that in a hair transplantation procedure. But what we're doing basically, if the patient has a sufficient amount of fat tissue, because we know that the majority of stem cells are existing in the fat tissue. So if we were able to harvest about, how much we're harvesting, an average of 80 to 40 cc. So that gives us a population of around 100 million of stem cells, right? Regenerative cells, let's say. Actually, those is a population, it's called stromal vascular fraction. It's a population of cells that can create a population of stem cells when you inject it into the site where you want to have the therapy for. So we're assuming that we're doing a hair transplantation, so we are injecting those cells after isolating them from the fat tissue, and we are re-injecting them with the fat tissue, which is called the microfat grafting, because we had to create the niche, the environment for it. And then when we re-injected it into the scalp area, so the nest is going to be ready to accept the new hair follicular grafts. And you have a lot of experiences in the previous clinics, and what you witnessed here, so we're happy to be together in the team. So unfortunately, some of our patients were not able to afford to do the stem cell therapy together with their hair transplantation. So what was your, let's say, first sight or impression when you saw the outcome, parallel outcomes between two patients when you were doing to one of them and not doing to the other one? So when we were in the follow-up, what was the major difference that you've witnessed?
The huge difference with the stem cell and without stem cell, I think in the patients who has the hair transplant with the stem cell, the result we can get so fastly. Normally, we can get the result in 6 months or 7 months, but we see the patients who has the hair transplant with the stem cell, normally we can get the result after 4 months or maximum 5 months.
So let's say that the life cycle of blooming, when we're transplanting the hair follicles, there's a life cycle, right, a span. So the blooming period, and I think they're not witnessing a shock loss. That was also an
Minor.
interesting thing.
Minor.
Or a minor
Minor.
shock loss.
Very minor.
Very minor that we could be irrelevant.
Yes.
When you're comparing it with the regular patients that are
absolutely.
having the shock loss. So I think the blooming period is very accelerated. And I think actually the thickness, the population of the uptake of the grafts is higher, I guess. Of course, we have to do studies about this. We're going to do studies, but this is something that we've obviously, me, myself, and you have witnessed when we did patients with stem cell therapy and with patients that we unfortunately were not able to do. So we had the opportunity to do a comparison between two patients. Actually, if you, in the video, we're going to share you two pictures. These two patients were simultaneously had their hair transplantation at the same date, almost, I think, a day after,
2 or 3 days.
a day apart. And you can see the huge difference at a timeline of 4 months. On the left is the patient who had the stem cell therapy, while on the right you see the patient that didn't have the stem cell therapy. So you can witness there's a vast difference between both patients. So basically, I believe that this is a huge opportunity and it is going to give a very important impact on hair transplantation procedures, and we're happy to be the clinic that is applying it. I believe that patients would wonder how the procedure is done. I think with your aid, with your sweet dream anesthesia or sweet dream, what we call the sweet dream concept, the B-safe concept, and the sweet dream sedation, that we are easily doing the procedure, and it takes about, let's say, 30 minutes.
30 minutes.
So we're using a very thin cannula, perhaps 1 millimeter cannula, and we're harvesting the fat from the areas that the patient is able to tolerate, or the patient where they have those stubborn fat packs, and then we try to harvest between 40 to 80 cc's of it. And then we have a special system and a kit that we introduce the fat in, and then we separate the stem cells from, and afterwards we recheck it under the microscope, and then when it's fine, we re-agitate it, we remix it with some microfat that we prepare with special filters, and then we re-injected it with syringes, with 16, I think with 18 gauges, into the scalp area, and we're creating an amazing breeding, let's say, nest for the new implanted hair graft. I guess you want to say something?
I have a question from our patients, dear Professor Dr. Karaaltin. The patient's question is how much stem cell should be injected?
Okay, this is a very debatable question. Actually, this is not just a rule for hair transplantation, because you know that stem cell therapies is being widely used, especially in wounds and in burn care and etc. Now, basically what is known as science, that 2 million cells per centimeter square is the minimum amount of cells required to create the niche. And when the niche is created, then the stem cells themselves are going to multiply. And then they're creating new stem cells, and those stem cells are going to secrete factors, which are called, in some vesicles or in some balloons, they're called exosomes. And those exosomes goes and blasts in the target area where they secrete huge amount of growth factors that would bloom and boom and boost the growth of the cells that you're targeting. For example, in this condition is the hair follicles. So that's how it works. 2 million cells per centimeter square is the recommended amount of cells to create the niche. And this is scientifically proven, to be honest.
Yeah, we can see the cells under the microscope before surgery.
Yeah, you can see it. Actually, it's inspected by our lab, where the biologists, they re-inspect. And, well, normally this is a standardized procedure. It's well known all around the world that when you create the Zook protocol, where you wash, digest, and then you isolate. Normally, when you have 180 cc's of fat with the kit that we use, you have almost 100 million cells. That is quite enough to be spreaded all around the scalp area where the hair is going to be transplanted.
After the hair transplant, the most important thing is viability of the grafts So normally we can lose some hair. Example, some hair follicles has 3 or 4 hair. So without the stem cell, we can lose 1 or 2 hair in the 1 hair follicles. But with the stem cell, 90% we can't lose. We don't lose.
Well, there are a couple of research about this. You're talking about the follicular unit, which would contain, as you said, 1 to 3 hair follicles. So in a unit, the maximum yield is actually achieved. So basically, as a clinic, you know that we're not just using stem cells to increase the yield of the grafts. Actually, we're using a special modality we invented with our engineers. It's called the vitality basin. Actually, it is a basin where you put the organ preservation solution. You're more familiar with it when organ transplantation, especially liver transplantation. So we're using the same solution and we're circulating it into a basin where we preserve the grafts properly.
Oxygenate.
And I believe that we're the only clinic in the world that does it. So I can be serious about that. So
absolutely.
I think that also enhances the yield, the viability, the yield of the viable grafts that we're transferring. So that's one advantage. And of course, doing the stem cell therapy is a very unique process. And to be honest, we're a unique clinic, not just in Europe or Turkey, I think almost all around the world. So I guess that if you have any questions, please, you can ask us from our social media, through email, or by our patient representatives. We'll be very happy to answer.
Thank you very much, Professor.
Thank you.
Thank you very much.